All right, good morning, everyone. Thank you for your patience. Welcome to Two Rivers Public Health Department's November clinical call. My name is Liz, and I am one of the nurses at Two Rivers Public Health Department. We have a lot of good information to share with you this month. Two Rivers Public Health Department serves almost 100,000 individuals in 7 counties that cover approximately 4,624 square miles. These counties include Buffalo, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper. And every month we have our mission and vision statements with our overall goal to be healthier communities for all. So this is our Two Rivers Public Health Department nursing team. We are sad to announce that Rita Call just retired in this last week. We will sure miss her sweet demeanor and dedication to public health, and we wish her the best. All right, so November is World Chronic Obstructive Pulmonary Disease Month. Last month on our clinical call, Marilyn discussed some of the season's biggest viruses of concern, including influenza, RSV, and COVID-19. Those with chronic lung disease like COPD are at greater risk for complications from these illnesses. November is COPD Awareness Month, and COPD Day is November 15th. They remind us of the ill effects on those diagnosed. The goal of World COPD Day is to raise awareness, share knowledge, and discuss ways to reduce the burden of COPD worldwide. So what COPD refers to is a group of diseases that cause airflow blockage and breathing-related problems. It includes emphysema and chronic bronchitis. Some of those symptoms that accompany COPD include frequent coughing or wheezing, excess phlegm, mucus, or sputum production, shortness of breath, and just overall difficulty of breathing. When it comes to COPD, the cost burden is about $50 billion per year. One of the worst effects of COPD is just how negatively it affects those individuals' quality of life. Things that are limited include like stair climbing, just start doing normal activities. Often it requires the use of special equipment. So having to move around with portable oxygen tank presents a challenge. And it also is it can be very isolating. And so, here at Two Rivers, we are able to do home visits to those individuals that aren't maybe able to get out in public very easily. And so one of our home visits this year, I was able to go visit an individual who says that she had had severe COPD, and she last year was in the hospital for much of November, December with RSV and COVID-19, which were exacerbated by that COPD. And she was very concerned about going out this year at all, even during the winter, and was very thankful that we could come to her home and give her vaccines. But also, she talked about how she might not go out at all this year, not allow visitors. And at that time, I have 15 minutes after I give that COVID vaccine to talk with these people, which I'm very thankful for. It's nice to get to know them. And we talked about how important it would be that she connected with her family and friends through other avenues like FaceTime or email during this time if she were to choose not to go out. So we can just see how hard it can be, for these individuals to live with COPD day after day. Treatment for COPD requires a careful and thorough evaluation by the physician, and some things that can help with its management include no smoking, avoiding any type of secondary smoke and air pollution if possible. Certain medications can certainly be helpful in managing those symptoms, and the use of supplemental oxygen. Speaking of respiratory illnesses, Here is some updated data on the flu. Our flu we're still in that bright green zone, and our flu activity really hasn't changed in the last 4 weeks. Some updated COVID information. This is from October 28th, so not the most recent data, but that was what was updated as of yesterday. You can see that much of the United States is showing in the low zone, but there are a few little spots where it's that kind of medium zone. And unfortunately, Buffalo County does fall in that medium zone for new COVID-19 hospital admissions per 100,000 population. And so just something to be aware of. Also, the positivity rate for NAT tests is about the same level in Nebraska at 10 to 14.9% per 100,000 population. And this just kind of trends emergency department visits for viral respiratory illnesses. This data is again through October 28th of 23. So not the most updated in terms of to today, but is what the most updated data was yesterday. So just kind of trending pretty even at this point. All right. So health alerts go out pretty, every so often. And there has been about 3 HONs that have gone out since our last clinical call. And just a reminder, if you aren't subscribed to receive those health alerts, we would highly encourage you to do so. I did put the link there at the bottom left in case that is something you would like to do. The first HON is on acute flaccid myelitis. It came out on October 26th. The goal of this HON is to bring awareness just to providers and the public about acute flaccid myelitis. In the last 5 years, there's only been 6 cases in Nebraska, but overall, since 2014, these cases have been increasing. And so just wanting providers to be aware that this is something to consider, especially if there's an acute onset with no other cause of arm or leg weakness, loss of muscle tone and reflexes. And a lot of patients will exhibit febrile illness 1 to 2 weeks prior to that onset of weakness. The second HON that came out in the last month or so was on the limited availability of nirsevimab during this for RSV in kiddos. So the main thing to keep in mind is just to prioritize administration. The littlest and the youngest kids would be the most important that they were to receive that 50 milligram dose. That's reserved for infants that are less than 8 months of age and less than 5 kilograms. And then that 100 milligram dose is meant for infants weighing greater than or equal to 5 kilograms, prioritizing those at highest risk for severe RSV disease. And it would be indicated primarily for those less than 6 months of age, but can go up to those less than 8 months of age if, again, they are at in that high risk zone. Right now, it is encouraged that infants that are born right now, because it's RSV season, that they just receive that first milligram dose in that first week of life, if possible. And the most recent HON that has gone out has to do with synthetic THC in snacks and candy. As you can see, THC in snacks and candy, that little picture of Nebraska on the left, it indicates how easily available it is throughout our state. So a lot of our high populated areas have access to these things. If you look at the picture on the right, it shows just how easily these are all the copycat snacks that have the THC. So just glancing at it, they look very much like snacks that you could buy in a convenience store that don't have THC, and that is kind of what can make it so dangerous, especially to children. Some of the problems with these snacks is that their production process is unknown. It's not something that's evaluated or has been approved by the FDA. It's not labeled very easily. And also it doesn't truly show how much of that THC is in each product. The health effects is unknown, as well as just how dangerous it is to children. As an example, the nerdy bears that are shown in that picture on the right, they're described on the manufacturer's website as a sweet, shareable edible that features a generous amount of delta H THC per gummy. Each gummy features 105 milligrams of THC and CBD, and there are 4 gummies in each bag. It only takes a very small amount to affect a kid, like 3.5 milligrams. So at 105 milligrams per chewy, that can have a huge, could be a huge poison issue for children. Between January 2021 and February 2022, the U.S. Poison Control Centers reported that 82% of accidental ingestions were in children, and that there were a total of 2,363 negative exposures to THC-containing products reported. So just something to be aware of and watchful in our local convenience stores. All right, so moving on to lead surveillance. This is something that is near and dear to my heart, as I'm one of the lead lead nurses here at Two Rivers. Lead is a toxic metal that can very much harm a child's growth and development. Surveillance is important because, that's the only way we're going to ever know if lead is something that is affecting a child. It affects young children much more immensely than it does us as adults. Young children will absorb about 50% of the lead that they are exposed to, compared to older children, which is only about 5 to 10% of the lead that they are exposed to, and adults it's even less. So the risk is greatest at less than 6 years of age, and the younger the child, the greater the risk. Some of the negative effects is that it causes damage to the brain and nervous system. It can cause learning and behavior problems, and even these behavior problems, they're finding that some adults that have exhibited criminal behavior, they're finding some link to lead exposure as children, that relationship. It can also slow growth and development and lead to hearing and speech problems. The good news is that lead, this is something that is preventable. So that's why we want to be really, when we do determine that a child has been exposed to lead, it is so important that we take a look at their environment. So one of the first things that we can look at is when the home that they live in was built. Homes built before 1978 often, and most probably, do contain lead-based paint. This was when lead-based paints were still being used in homes. What can happen is when that paint peels and cracks, it can lead to paint chips falling or being easily just picked off around baseboards and window wells. Those paint chips are attractive to children because when they put them in their mouth, they pop kind of like those Pop Rock candies, and they also taste kind of sweet. So that can be a real factor for kids continuing to consume those paint chips. Lead dust, it just can get everywhere, on kids' toys, on any furniture in the home, on floors. So young kiddos, they're crawling on the ground, they get it on their hands, they maybe put their hands in their mouth, or they put those toys in their mouth. Maybe they have a snack and haven't washed their hands thoroughly. Very easy to consume some of that lead inadvertently. Certain water pipes may also contain lead. Lead can be found in things that we buy off the shelf every day, such as toys and toy jewelry. There's been recent recalls of t-shirts with graphics that contain lead. Lead is sometimes found in imported candies, spices, home remedies. And then, you know, a parent's job, they may work in an environment where they bring home lead dust. And if they come into the home, have it on their shoes, have it on their clothing, kiddos can get into it that way. And then also certain hobbies, maybe a family enjoys fishing or hunting, lead lures and lead ammunition there can be some contamination to kids that way. So lots of different ways. Oops, excuse me, sorry about that. Lots of different ways a child could come in contact with that lead, unfortunately. So, and this is just a recent instance of where lead may be where you least expect it. Just this month, there has been a recall of 3 apple puree products that are actually quite widely available and have been available in our jurisdiction and community. The 3 brands that have been brought to our attention are Wanabana, Schnucks, and Weiss. Wanabana is available at multiple retailers, including Amazon, Dollar Tree, and even Dollar General locally here. Schnucks is available at the Schnucks and Eat Well Markets grocery stores, and Weiss is available at the Weiss grocery stores. It has been linked to 7 adverse events, and we have gone to our local Dollar Generals just to ensure that they are aware of this lead recall and that they have been diligent about pulling these products off their shelves. We have not heard of any individuals in Nebraska being affected by this lead recall, but last week there had been at least 1 case in Kansas. So it is affecting children and families all across the United States. So in terms of lead testing, this can be kind of confusing sometimes, as it can be hard to know, should I test a child for lead? Should my child be tested for lead? And so this algorithm is meant to help kind of eliminate those gray areas. A blood lead test is the only definitive way to know if a child is exposed, and it is very important to us here at Two Rivers that no child is missed or forgotten, as we have seen how negatively lead can affect these kids. So this algorithm is meant to hopefully make it a little bit easier to determine when that lead testing should be done. The first indicator would be as if a child is a Medicaid recipient, and Medicaid covers the cost of a blood lead test at both 12 and 24 months, regardless of any risk factors in their home environment or places that they frequent. And if a child is between ages 2 and 6 and they have never had a blood lead test done, then they would still want to have one done just to kind of catch up and double check that lead exposure isn't occurring. The second indicator would be if a child lives in a targeted zip code. The most updated list of targeted zip codes in our jurisdiction at Two Rivers include Overton, Elm Creek, Gibbon, Campbell, and Franklin. Individuals in this, kiddos in these zip codes would again qualify to have that blood lead test done at both 12 and 24 months. And then if those kids haven't been tested previously and are between the ages of 2 and 6, would want to at least get it checked once in that time frame. So all other kids, regardless of zip code and Medicaid status, should be assessed by a risk assessment questionnaire. Some examples of some questions that could be on this questionnaire include: does the child live or spend time in a house or building built before 1978? Does the child have a sibling or playmate with lead poisoning? Does the child live with an adult whose job or hobby involves lead? Does the child's family use any home remedies or cultural practices that may contain or use lead? And is the child included in a special population such as foreign adoptee, refugee, migrant, immigrant, foster care child? So a yes or don't know answer to any of these questions would warrant the need for further lead testing. And it would even maybe, cause the provider to want to ask further questions, such as, Does a child spend time with a grandparent who lives in an older home, or does mom or dad work in construction? So it can really help stimulate conversations in terms of evaluating that child's environment. Again, the goal is just to make sure that no kids are missed. Every child is tested that needs to be tested. We just want to make sure that, just want to be inclusive when it comes to determining when a child should be tested for that lead. The next slide, let me get to it here, was put out, our data analysts put this together for us, and it just helps us visualize how many of the homes in our jurisdiction were actually built in or before 1978. So each county, it kind of shows the percentages of those homes. And just looking at that, you can see that we do have a lot of older constructed homes in our jurisdiction. So just something to be aware of as you consider kids coming through your clinic, or even your own, family members, friends. Just make them aware that just living in an older home can put a child at risk for exposure to lead. So when it comes to that actual lead testing, so you've decided that maybe you've decided that the child that you're seeing today is a good candidate for a blood level test. So what most providers start with is a capillary sample. This is just an easy finger prick or heel prick, just requires a small amount of blood. And so then that chart on the bottom left helps determine what you would do if a child did have a high capillary lead result. So what's high? High would be higher than 3.4. So anything 3.5 or above would be considered elevated. Now, a capillary test, an elevated capillary test does not confirm that a child has been exposed to lead. What needs to happen is that child would need to come in and have secondary testing done, and that would be done by drawing a venous, checking that venous lead level. And that was the only way that is a way we can confirm that the child does have an elevated lead level. So the higher the capillary result, the more immediate the need is for the child to come in and be retested, and just to confirm that testing. So you can see if the child's capillary blood level is 3.5 to 9, as long as they're getting in within about 3 months, that's considered okay. But as it gets higher, there's more of an urgent need to get in and get tested sooner. Most of the time, we would encourage providers to get those kids in right away within the next week if possible, just so we can kind of, know for sure whether or not there is indeed some blood and environmental lead contamination. So once you have that venous result, if it's elevated, that does for sure confirm that a child does have an elevated blood level. Occasionally we'll have an instance where maybe a child can't tolerate having that venous draw done. And if that's the case, a child can confirm an elevated blood level with 2 capillary results. They just have to be done within a 3-month time period. So you do have that confirmatory value either being a venous sample or 2 capillary results within about a 3-month time period. So keep in mind, though, you do not necessarily have to start with a capillary sample to confirm a child's elevated blood level. That's what most providers do. But if you have a child that maybe it's hard for them to get in to an appointment, or maybe they aren't necessarily consistent with their doctor's appointments, it might be wise, if you feel like there's a good chance that they are indeed being exposed to lead, that you start with a venous sample. There's nothing wrong with doing that. All right, and so one thing I can say with kids that do have an elevated venous lead level is most of the time, pretty much all the time, the families obviously don't want their children to have an elevated lead level. And so what we'll do at Two Rivers is we call these families and we talk to them and we provide education, sometimes they're nervous or scared that we're, mad at them, but we realize that a lot of times you can't control, or, can't control that your home is an older home and there's problems with the walls, or you can't control that you're outdoors and your kid likes to put dirt in his mouth, and there's there's a lot of stuff that is hard to control, and maybe you don't have the funds to fix it. And so what we do is we try to come up with ways to with whatever means they have to help fix whatever the cause of that lead exposure may be, whether it's just increasing dusting in their home, vacuuming more frequently. Maybe there's some old antiques in their home that they didn't think about that could be causing that elevated lead level. Maybe their child is eating those paint chips that they see out in their sunroom. So there's lots of we just want these families to know that we are part of a team and that we're there to help them. Now, if a child does have a confirmed lead level of 10 or greater, the state will often they will provide someone to come and test the child's environment. They have like an actual the testing equipment to determine if there's lead in the walls. There are they can take samples of dirt around the home, and that can kind of help these families maybe pinpoint exactly where this lead exposure is coming from. In the near future, we hope to have our environmental specialists. The plan is for our environmental specialists to become trained and able to do this, so we can more easily help the families in our jurisdiction that may be struggling with trying to determine where this lead is coming from in their child's environment. Another good news for our health department, if you look at this slide, is that we received a grant that will help us begin a lead hazard reduction program. It is something that we'll be working on over the next 4-ish years. And so we're just in the early stages of this. And this is something that's meant to help families that maybe don't have the means, and not necessarily even just families that are homeowners, but even private, like somebody who owns a rental property who maybe doesn't have the means to fix any problems with, potential that may be leading to that lead exposure. So it's something that we are really excited about and really looking forward to developing over the next 4 years, just so that we can, help more families in our jurisdiction that are dealing with this lead exposure. And just one more final point on lead. It is something that we all, everyone's goal is to keep our kids safe in our jurisdiction. So anytime you as a provider or you have family members, please don't hesitate to point them in our direction. We're always happy to answer any questions you have about lead, help people assess their environment over the phone, answer any questions that they may have. We just want people to know that this is a team effort, and we really want to help keep all of our kids healthy and safe in our jurisdiction. Finally, here we have our slide that covers our vaccine clinics here. I know we're partially through the month of November, but this just kind of gives you an idea of when our regular and childhood vaccination clinics are. A lot of these require an appointment, especially with our COVID vaccine, because we have a lot of, just like a lot of other places, we're experiencing some supply issues. So please don't hesitate to call and schedule ahead for those COVID vaccinations especially. And if you have any questions about any of the vaccinations that we carry at our vaccine clinics, please reach out to us at 888-669-7154. Well, that completes our November clinic call. Thank you all so much for joining us today. Are there any questions? All right, well, thank you all so much. You have a wonderful day.